Hi, my name's Sophie and I'm co-president of Dundee Widening Access to Medical Skills Society.
And my name's Callum. I'm the other co-president of Dundee's Widening Access to Medical Skills Society. And welcome to your introduction to DWAMSS virtual shadowing in medical students. In this opportunity, you're going to get the chance to shadow 5 different medical students across each year of the medical school. You're going to get to attend their lectures, you'll attend their interactive workshops, and you'll also follow them into clinical skills where you'll be doing some communication skills teaching and also some clinical skills teaching. Through these experiences, you're going to get to learn about some common medical conditions. You're also going to get to learn how it is that we examine patients, and really importantly, you're also going to learn how it is that we actually communicate with patients, how it is that we take their history, and how it is that we come up with their diagnoses. From this, we hope you're going to get a really good understanding as to what it is that medical students learn when they're in medical school, and also how it is that medical students are taught, because this is something that you're unlikely to have been able to experience before. So, in this short introduction video, we're going to talk you through each of the years, and before then actually telling you how it is that you can sign up for these experiences. So first off, Sophie's going to take you through the first to third year virtual shadowing experiences.
So welcome to your first year experience, which is based on the respiratory system. During this experience, you're going to follow Isabel through a lecture, a communication skills session and a clinical skills session. Throughout the lecture, you're going to learn a bit about the anatomy of the lungs and the physiology of the lungs. This is going to lead into you learning a bit about the common condition of asthma. You'll then go into a communication skills session, which will be where you'll learn how to assess pain. You'll then go into a clinical skills session, which you'll be taught about how we examine the lungs and some of the things that you can spot on examination. Next, you'll go into a day in second year, where you'll follow your student Heather. Heather will be attending some lectures based on the musculoskeletal system. Here, you'll learn a bit about the bones of the skeleton. You'll then go into a workshop which will be based around fractures, and you'll get to spot the difference between some x-rays. So you should be paying attention within the lecture so you can answer the questions in the workshop. Here, you'll learn the ABCDE approach, which we learn in medical school to assess the unwell patient. For the third year experience, you'll be following Coyote through a day in psychiatry. Now, psychiatry is a little bit different to the other experiences you'll have, where you'll first start off with a lecture based on depression. So you'll learn about the symptoms of depression and the treatments that we use and how they work on the brain. You'll then go into a workshop which is based around the stigma that can sometimes be associated within society with mental health conditions. You'll then go into a communication skills session, which will be held by a consultant psychiatrist, where you'll be able to watch some clips of a consultation and you'll learn about the mental state examination that we use to assess psychiatric patients. I'm now going to pass over to Callum, who's going to tell you a little bit about fourth and fifth year.
So in fourth year, you guys are actually going to be shadowing Sophie, who you've already met. And Sophie's in general practice. What this means is that Sophie's actually going to be seeing real patients who have real symptoms, and both of you are going to use the skills that you have learned over your first to third year, but to take a history from this patient and try to suss out what's going wrong, so that you know how to appropriately manage them. So hopefully we're paying attention in first to third year, because you're definitely going to have to be using some of those skills again, listening to the patient closely. What you'll also realise, and one of the things that we as medical students really realise when we go into general practice, is that patients aren't just a list of symptoms. It's really important as medical students and therefore as doctors that we actually appreciate that patients are people, and that therefore it's really important that we actually understand how they live their day-to-day lives, what's happening in their social lives and their personal lives, because that actually is really important for us knowing how to manage patients appropriately. So along with learning about the patient's symptoms with Sophie, you're also actually going to get to learn a little more about the patient themselves as a person. In fifth year, you're then actually going to be shadowing me, and I'm going to be spending a day in anaesthetics that day. Because along with mostly being in clinical practice, you also learn some more advanced skills in your fourth and fifth year in medical school. And the skill that I was learning that particular day was how to manage a patient's airway. Again, you're going to be learning a little bit about this in second year with Heather, so make sure you pay attention and take some notes, because it's definitely going to come in handy for fifth year. Except in fifth year, we're going to be learning some more even advanced skills with one of the anaesthetic trainees. And it's going to show you some of the things that we get to learn and do in medical school.
So, now you've heard a bit about our virtual work experience, we hope you'd be really keen to sign up. Now, the sign up link will be on the You Can Be a Doctor website, and we do have a bit of a limited capacity per month, so we will be prioritising widening participation groups, but don't worry, please sign up anyway, as everyone will have the opportunity to do the experience. If you have any questions about how to sign up, or about the experience whilst you're doing it, or afterwards, please come along to one of our fortnightly Chat with a Medical Student events, and the Eventbrite link to that will be on our social media, so please keep a look out there.
So as always with these experiences, we've got a lot of people to thank. First and foremost would be the Down Memorial Trust, who's very kindly funded this project, which is therefore going to allow all of you guys to gain these experiences. Also the University of Dundee School of Medicine, who have allowed us to use their state-of-the-art facilities for to film in, for to recreate these virtual lectures, workshops. And also the Dundee Clinical Skills Department, who have allowed us to both utilise their equipment and also their clinical skill spaces for to film these interactive clinical and communication skill sessions with you. Lastly would be You Can Be a Doctor, who have both very kindly helped create our website for us, and they're also allowing us to host these experiences on their website, which should make it a lot easier for you guys to access at home. As Sophie said, if you've got any questions, please do get in touch. Please follow our social medias to keep up to date, and we really hope that you enjoy shadowing our 5 medical students.